Ready? Okay, I'll call this meeting to order. It's Thursday, August 28th, 2025, and it is 1 o'clock, and we're here for some Panhandle health updates, and I will turn it over to Erik.
Thank you, Commissioner, and Commissioners, I appreciate your time today, and I hope to make a regular practice. I struggled a bit last year, but hope to make a regular practice of coming up at least quarterly to chat with you and provide updates on what the goings on are. I know Commissioner Cowles is in our meetings, and so some of this will not be new news. I did bring Jason Pepin, who's our environmental division administrator, so he's going to provide a few updates on those services, which we continue to see in significant demand. Our area is unique, while other areas of the country seem to see slowdowns in growth. We continue to pretty much go full speed ahead. And Mary is here to share. I know ICP is a huge program here in this county, so she's going to provide some updates there. So I guess just to get into it a bit, just wanted to share the programs that aren't being represented here today. And, I guess one of the things that I do want to share with the commissioners that I think is important is the regional approach of a health district, especially with the smaller counties, is we have a depth to where when we have loss of staff or that serve a given county, we can fill those fairly quickly. A recent example is in Boundary County. We've had a staff person working up there in environmental services for a number of years, and for a number of reasons. He loves the job, but family's moving to Lewiston. We're able to, cover that work and ensure continuity of services, which is, I think, particularly important in environmental services when we're talking about timelines for people getting homes built and structures up, their businesses, contractors, and so forth. So that continuity of service, I think, is very critical. And I think that we do a very good job of providing that, again, particularly to the smaller communities. In talking with Tim Blurtling, they've been struggling to find a planning director for a number of years because finding somewhat specialized services can be challenging. And certainly with our environmental projects or developing a piece of property, there's no cheap projects anymore, right? Everything's $500,000 or better. So the liability with that work and having competent people on the field making those permitting decisions, because once we issue a permit, we own it. We're not telling anybody to take any houses down or anything. So it needs to be done right, and it needs to be done right the first time. So I think that's of significant value to all of the counties, frankly, but I think particularly to some of the smaller ones. So I'll kind of get off that soapbox. Okay. And but other areas that we're working, I know that are important to Shoshone County is in regards to our substance use disorder program team. We have hired an individual that's going to expand our education that we take to the schools. There's currently the program that's Catch My Breath that's largely nicotine focused, but there's an additional curriculum that's going to be moved out that expands into other substances, such as opioids, such as the other drugs that they may see that are, they look like Skittles or, they look like candy things. Yeah. A better way of educating those individuals. We have also moved Narcan to all of our office locations, so it's available there. A new area that we're looking at moving into is care coordination, more specifically working with first responders in post-overdose type situations to try to intervene and help guide those individuals into effective recovery and treatment programs. We don't provide a treatment program as far as issuing medication. We are looking at some models for providing recovery, some peer support, those type of things to help people successfully move through the process. That would involve hiring a social worker and whatnot, but we're taking a serious look at that because we do have those opioid settlement funds that are available to us. So we're not talking about requesting extra funds from the county or needing a grant. That is funds that we do have available to move that project forward. We continue to have strong demand for our WIC services here. We also are serving a number of families with our home visiting programs. That's where we're going into, I'm going to say my words, somewhat higher risk type of home environments where we have either a specially trained nurse or we have a specially trained health education specialists that are going in and basically providing no-cost support to new mothers or families to try to help give them guidance and support. Really, the goal of it is to keep families together and to share that program. We do put some county support into it, but it's predominantly funded with about $1 million federal grant, and then also there's a state appropriation of, I think, $270,000. So largely self-funded. I guess one other note is we have 2 epi staff, so a very small program, but they do stay fairly busy with tracking communicable disease and investigating them. As you may know, there have been 2 measles cases in our region, one in Kootenai County and one in Bonner County. We do try to conduct investigations and then issue press releases not to scare anybody by any means, but simply to allow them to know where those, and we don't identify individuals, we don't provide any identifying information, but just to let them know that if you happen to be in this given Walmart at this time, and because 9 out of 10 folks, that are exposed to measles, if you're not properly vaccinated or haven't had it, you're going to contract it, just so they can make decisions to avoid certain areas, or if they were in certain areas, that maybe they should keep an eye out for it. Sort of bridging from there into clinic services. I did, just to be absolutely candid with the commissioners, I did provide information to the board last Thursday at our meeting, where it is my recommendation that we do close up clinical services. And to share with this board this isn't news, but I had spent quite a bit of time to share with the board. When I was a kid, my mom was a public health nurse. She worked in Boundary County for about 27 years. So when I was going there, they had 3.5 nurses working out of that office. Now it's largely a ghost town. We don't even have a full-time nurse working out of that office. Similar, frankly, here in Shoshone County. And the question became, what happened? And largely I focused on what did we do? Was it, and this came up during the workshop, was it the quality of the service? Was it advertising? What was it that changed? And after spending quite a bit of time of looking internally, I started looking at the federally qualified health centers like Heritage Health and Connexu Clinic, thinking, and it became, at least to me, fairly clear that as a significant component of the Affordable Care Act, the amount of federal funding put into those entities went up, it more than doubled, in addition to capital improvement grants and so forth. And at this point, those facilities are receiving, in excess of $3 million to stand up their services. We get about $370,000 in federal support to stand up our service. So when I'm looking at, it's kind of it's a situation where it doesn't make sense to stand up duplicate services that they can provide. And frankly, they have greater depth because of their funding. They have pediatricians, they have dentists. I think that we have historically provided a high quality level of service, but it doesn't make sense to use essentially what $360,000 that we have set aside for FY26. It doesn't make sense to use county support dollars to stand up services that individuals can get in other areas. So that was my recommendation to the board. I think that the board has tabled that for further discussion. But I wanted, because that has been such a core program of the health districts for 50 plus years, I did also want to share with the commissioners what my logic was in making what frankly is a pretty major recommendation to the board. So we'll see how the board weighs in on that in future meetings.
Okay.
That's sort of, I guess, the bit of spiel that I had. I'm open to questions on that. Otherwise, I'll probably hand it over to Jason next.
Okay. Do you have any questions? No.
Okay.
Sure,
Thank you.
So yeah, thank you. As Erik said, my name is Jason Pepin. I'm administrator of the environmental health programs. Work with Marion Institutional Controls Program and then the Public Health Emergency Preparedness. And just some background here, I've worked in Shoshone County since about 2006, off and on. So a lot of history here, knowledge of the area, working through difficult sites, even working in the area when Dan Martinson first came on board. So a pretty good perspective on the county. And with the environmental health, main services that we have, or the main programs, would be septic program, obviously, which is in wastewater disposal for any properties that are not connected to municipal sewer. Also, we have a role through the subdivision processes in terms of lifting the sanitary restrictions, so working with the county on that, and then the food safety program. So those are the main programs I'll kind of touch on. And I'll keep it general, but if you have any questions, please jump in. But, Shoshone, as you know, is a very interesting county, presents, a lot of challenges in these programs. And the septic program, the number of septic permits that are issued relatively low compared to other counties. Many reasons for that. Part of that, the extensive South Fork sewer system that we have in the county. Also, just the limitation of private property developable private property. But one thing that really stands out over the years in Shoshone County as the county develops is that most of the more easier, straightforward properties have been developed. So we permit a much higher percentage of complex alternative systems on properties, and so throughout through the subdivision process to the building stage process, we work as much as we can to find as reasonable solutions as possible, but ultimately there's statewide rules that we implement, and it's the system that's required is based entirely on the site conditions of that property. And so, our goal is to create awareness throughout the process so that when people are buying properties, they know what type of system is going to be required and so forth. And even, currently something that Dan Martin, Sid Mary, and I are just now getting off the ground is hopefully get a realtor class this fall, winter, hoping to expand that, just to build awareness education at the realtor level. But then also at the state level, because again, these are statewide rules, guidance, and so forth. I'm a voting member on the technical guidance committee, which develops the technical guidance manual that really drives the program and gives us all the options. And that's really what my role is on that committee, is trying to develop practical solutions that we can implement here. And we've really expanded our toolbox. There can be costs associated with some of these more extreme alternatives, but it does provide options. So again, if the buyers, property owners are aware of the costs associated with that, then this allows for them to build essentially. But then also at the state level, if we can approve technologies, bring new technologies in that allow for more reasonable applications. That's what that group really does. I know a lot of times there's concern about changing rules and being more restrictive. In this context, that's 100% what we try to accomplish, is bring more tools to the toolbox that can translate to more reasonable approaches. So that's just something that I think is important within the Shoshone County context, because that is our role on that committee. We have very different site conditions, geology, and so forth than a lot of the rest of the state, and just bringing that perspective. We also have a lot of historic properties here. Shoshone County has an amazing, rich history, and so working through these in a way where we're able to work with property owners to maintain their property rights, but then also make sure that we're meeting state of Idaho requirements. So whether it could be anywhere in Shoshone County, up in Burke Canyon, for example, in Pine Creek, anywhere, Danger River, North Fork, and there's historic properties throughout. So that's a really big part of the program here is working through those situations as these sometimes 100-year-old systems fail, replacing systems in a reasonable way, that still meets state of Idaho requirements. So that's a big part of the program in Shoshone County, as well as working through a lot of the larger projects. Because same thing there. We have a lot of these older existing, and something like the Snake Pit. Working through that. That was one of the first experiences I had in Shoshone County, is when the Snake Pit system failed, and trying to find a replacement. Sewer is not an option. There's not a very good location for it. But we're trying to find a way to keep that business open, essentially. So continuing to do that, even recently when the Big Eddy burned down, working with Dan, others, to create a way that we can still allow for a successful business to be, so we were able to work with DEQ to get the public water system approved, so that we can move a mobile food truck on site, and then also working with the owners of the lease land next door to work towards a conditional use permit. Again, all working within all the different crazy parameters in that situation, where the lease lot's owned by the state of Idaho. They don't have an easement. The drain field for all of it is, basically 65 years old. But just trying to do this in a way that's still protective of public health, but also allows for successful businesses. That's really what we try to work towards whenever possible, with these win-win situations. Recognizing, the history, the property rights that go along with it. So that's really a big part of our program there. On the subdivisions, again, that's a challenging program because so much of the land in Shoshone is either federal land, public land, or floodplain.
Or straight up and down.
Yeah, exactly. And so just working, and really appreciate the opportunity to work with Dan Martinson. And he's such a solid professional, such a good context on this. But, developing processes that work well for Shoshone County, even before Dan, when Jeff Legge was here working to develop, recreation subdivision ordinances that can allow people to subdivide their property in areas that may not be buildable. So there's just examples. And Dan and I are currently having conversations along those lines about, maybe modifying, if necessary, subdivision processes depending on the needs of the county and what works best. But again, working towards having buildable parcels that result from the subdivision process, so that we don't end up in a position where people buy properties, being told or thinking that they can build on it that are now unbuildable properties.
Yeah.
We've had that experience in other counties, and it's really not in anybody's best interest to go down that road. So again, really appreciate Dan's involvement in that. And it's just that even if even I remember thinking once working with Jeff Legge, where we had some of these floodplain ordinances and subdivision ordinances ironed out, but over the years things change and just constantly having to modify it. But we definitely want really like to be part of that process whenever possible. And then on the food safety side of things, while mentioned in the septic program relatively lower numbers, it's kind of the opposite. There's many food establishments in Shoshone County, about 150 or so fixed facilities throughout, and same issue there, where many of these are very old buildings, but we basically apply a risk-based approach to ensure safe food supply, working within the context of that facility. And especially as some of these properties change hands, whether it's Snake Pit over the years, Country Lane Resort, I don't know if that's even called that anymore. We're currently working with this on the Big Eddy. So just to try to thread the needle in terms of meeting state of Idaho requirements, working through these existing facilities, and again coming to these win-win solutions that still are protective of public health, ensure safe food supply, and so forth. So just in general, that's kind of how we approach it, as well as working with temporary vendors for all the many events that Shoshone County has. So whether it's things like Silver Mountain events, the Huckleberry Festival, any of those, just working with those vendors to make sure that they can provide a safe food supply. And so obviously that's increased significantly over the years in Shoshone County, and many successful events. And that's really our goal, is just allowing the businesses to succeed, but also not resulting in a bunch of foodborne illness outbreaks. We've been very successful in that. And then the other programs that I would represent would be the Public Health Emergency Preparedness Program. And with that program, we're very integrated within the LEPCs, the local emergency planning commissions, but also especially the situation that the counties and Shoshone County is in now with the funding challenges that we've had conversations with Dan, and we're really starting to put this into place, is using the deliverables that we have for the state of Idaho contract, this contract here at the Idaho Department of Health and Welfare, using those deliverables to meet county needs. So for example, we're really fortunate to have our planner in that program. He's a retired, I believe, lieutenant colonel in the Army, and he's so effective at that. And so he's integrating with Dan as in emergency management capacity to develop emergency operation procedures and different things that Dan's mandated to produce to assist the county, as well as identifying other resources in the county and also gaps, developing exercises to try to work through emergency situations, so that we have things in place now, so that we have an emergency. So that's a program that we're really hoping to expand that relationship and really so that we can provide assistance to the county and especially, Dan is, and especially now he's, starting to take on more of the code enforcement role. So, those are just some of the aspects of it. And I guess on code enforcement, we had a really productive meeting in here yesterday, getting kind of the groundwork established, really hoping to help Dan with some of the things that we've learned working through these in other counties, as well as just giving him some templates from the state of Idaho system so that we don't have to reinvent the wheel, and just really appreciate his approach, and then the opportunity to assist within that. So I don't know if you have any questions about any of that or.
No. Appreciate it.
Yeah, thank you.
But and I guess before Mary does, I two things that I'd like to comment on what Jason has said is one of the things that I think, and maybe it's been presented before to this group, but Jason mentioned tools in the toolbox for systems and so forth. But one of the more basic solutions, and I think, and Jason was instrumental on this, and the health district was in advocating to the state, was when they were proposing reductions in surface water setback. Through a very thorough review of literature across the country, it became clear that Idaho setback standards were somewhat archaic, and that you could move systems much closer to the water and still be as protective. And so we were very much advocates for that. There was a lot of work done, and that is another tool in the toolbox. So it's not more expensive. So a lot of, when you're talking about this property that's floodplain or its proximity to rivers and creeks, that is an advocacy effort, and not just advocacy, but an involved effort where we were able to create additional solutions for property owners. That's not additional expense to them. It's not a fancy technology or whatnot.
And on that, thanks, Eric. I totally forgot about that. Yes, and that's instrumental in properties along the North Fork of the Coeur d'Alene, the St. Joe River. Even in Benoit County, we've been dealing with a number of properties that the county assessor's office picked up on, and we were kind of stuck because they wouldn't be able to meet the setbacks to the St. Joe River from the St. Joe City area. Almost immediately able to apply those reduced surface water setbacks. So now we're able to get systems permitted. And as Erik mentioned, the setbacks that were in place previously, as we were doing the research, and I was part of that effort, they were about double, if not triple, any of the setbacks essentially anywhere in the world, and it just didn't make sense. So that was kind of, between us and DEQ proposing that, and we were able to get, starting with the technical guidance manual. That was the first way we implemented it, recommended to the legislatures. That was implemented in rule last year. And then one other project I wanted to touch on real briefly, just forgot to mention this one, but it is important because I'm not exactly sure where it's going to go, but currently working with the Sunshine Mine, and a lot of the surrounding properties. As the Sunshine's getting ready to get the antimony plant up and running, and potentially the mine. And it's something that we've been aware of for a while, and just trying to now, it's starting to become necessary, is that there's many of the residents, and I'm sure you're aware as Commissioner Cobb living in the area, but several of the properties in the Big Creek Valley bottom are, the wastewater stream, rather than have an on-site septic system, they are connected to the tailings line that goes to the tailings pond, as well as the golf course and the daybreak up above. So we're currently working with the daybreak and the golf course to get those replaced. We've evaluated both of those properties. They basically have an old metal line that used to go into the tailings pond. It's broken and basically surfacing on the side of the hill. So currently working through that, but then also depending on what the outcome of, some of the projects that the Sunshine's working on, and then potential, maybe, long shot, but potential availability of sewer. The Sunshine Mine's been working with Peter Staten at the South Fork Sewer District to potentially extend sewer up to Big Creek. Mm-hmm. If that's not feasible, then we would work with those property owners to put replacement systems on their properties. But in that case, just like we see in Burke Canyon, that eliminated wastewater discharges directly into the creek, but then there's the properties are still limited. So if we are able to gain the sewer in there, and there's a lot more. You don't have most of your property taken up to a septic system. They can add additional bedroom units, expand homes, and so forth. So that's the goal. That's obviously a big hurdle financially, but so mine's been focusing more on the connection to sewer aspect to see if they can get sewer extended. we're focusing on these properties to eliminate that immediate threat without taking this down an enforcement path. We even waive the fees to get everything going. We've got the daybreak. We've not exactly. We have issued a permit. We expected that to go in several months ago. Just met with the golf course last week and just trying to nail down the site. But yeah, so that's just a current project. It's going to be ongoing, but it is a larger project, and it's just shown that probably aware of.
There are some that are on private septic too.
Probably the majority.
Yeah. Mm-hmm. And then, but there is still some.
Absolutely.
Yep.
Including the mine properties. That's the other part of it.
Wow.
So there's, it's obviously the Sunshine Mine is, it existed long before there was any rule or even health department.
Right.
But that's part of the equation. And that's the same thing with Lucky Friday. They were able to, when they connected to the South Fork, the sewer system, they were able to get those discharges out of their tailings pond. Mm-hmm. Again, I've been aware of this since about 2007, 2008, and really just waiting until whether it was an IPDS permit, NPDS permit, or like Sunshine, where it's some kind of change in their operation that's going to necessitate that. So not, trying to force it, knowing that this is a historical practice. It's not resulting in a public health, crisis. I don't think the Sunshine Mine tailings pond is discharging now, and honestly, when a mine's fully operational, that's probably the least of the concerns. Is small. It's just a fraction of the water that goes into those ponds. So again, just trying to work with it as much as we can with the situation without taking it down the enforcement path.
Yeah.
Okay. Thank you.
And I don't have a lot. I think you guys are pretty familiar with my program. But I did want to give you an update that we just finished out our annual blood lead screening event. We saw preliminary numbers were at 362 individuals. And last year we were just under 400, so still decent size amounts. I'm working my way right now through notifying the children that have elevated blood leads, contacting families, working with them to set up in-home investigations where we go into the home and find out the exposure sources, try to identify those to eliminate them. And then my inspectors are busy as all get out. We have 3 inspectors for the ICP, and we're right now, I went through our last 10 years of information, and we're averaging about 650 permits per year that we're issuing out of my office. We were up to over 1,000 in 2021 when we kind of had that big boom, which everybody experienced that. Now we're starting to kind of come back down. But it's still consistent, it's busy, and as, Jason mentioned, the properties that are being developed are those difficult ones. They're the hillsides, they're the steep ones, so we're dealing with stability issues, and a lot of the growth is happening in the Page area and outside of Smelterville on the hillsides there, which were all impacted by the smelter emissions. So we have almost every property being developed in those regions have a 6-inch layer of impacted soils that we have to work with the property owners to develop. But it's been really great and positive because, like we've told people, the more dirt disturbance you're doing in those areas, the more you're diluting that stuff, you're mixing it up, you're scraping it off. And so it's a process of making sure people are doing projects safely, but also not scaring them away so that they're not like, we don't want to develop here, So our goal, our office is always, in the mindset of, it's all doable. It just might take a little bit of extra time or thought, but let's try to make it not so it's cost prohibitive and make sure that we can accommodate people and continue seeing growth in our county. As much as I love my small county, but we still need the tax dollars and the revenue. So I understand it's always a balance, right? But so we're just plugging along. I do also since I am in the Kellogg office, I participate with all the local emergency planning meetings as well, and I also team up with our epidemiology department. So any elevated blood lead that comes through basically in my jurisdiction, I handle all the epidemiological studies and reporting and all of that stuff. So kind of able to assist in these other programs that are really essential to keeping our communities safe and healthy. So,
I think just to sort of wrap it up, just to make clear, we've spoken a lot about technical aspects and numbers and so forth, but I think just stepping back from that, it's important to recognize that at the end of the day, we're public health. We're trying to improve the lives of the community, and fortunately or not, I think we've been we've been very effective partners with the counties in in growth in the communities. And
Mm-hmm.
and the unfortunate or not part is that I think we've been very effective at, in this case, in some cases, remediating areas that have had environmental impacts, in other areas preventing issues that have happened in other areas of the state, and it's due to the expertise that has been developed.
Mm-hmm.
And unfortunately, the unfortunate part is that it invites growth,
Mm-hmm.
to these areas. But again, as those densities increase, it becomes even that much more critical
Mm-hmm.
that these programs continue to be well run and effective, because those impacts on our environment and our community are just ever increasing.
Yep.
Mhm.
I agree.
Yeah, and on that, that's one thing that we're very fortunate in the 5 northern counties of Idaho. We are the only region in the state that does not have any nitrate priority areas. There's 35 nitrate priority areas in the state of Idaho. There was another recent one developed in the Lewiston area. And just in the context of, construction, talking to people down there, there's a couple subdivisions they're working through now where, property owners are having to dig $150,000 wells to punch through the contaminated aquifer. They have to put in very expensive septic systems, so they're not adding more nitrates to that. So we'll really try to do what we can.
Yeah.
And one of the things, the state rules do not address septic density. And so instead, what the state of Idaho's starting, and it's fairly early in this, but it should be really interesting to see. So what they're trying to do, and what I'd like to do, is do extensive geological analyses of smaller aquifers. So, for example, they've done an assessment of the Sagal Aquifer in Bonner County as a pilot study. Provide that information to the counties about potential impacts of density to help make informed decisions, land use decisions from a zoning standpoint, septic, or just density standpoint. Recognizing that the state of Idaho has a lot of geologic diversity and so forth. So rather than taking like a broad approach, make it more, whether it's county specific or even like a subset of the county, just so that as commissioners and planning and zoning commissions and so forth have data that they can use to make these decisions, because that's really important that we do protect our ground and surface water. Something like 95% of Idaho residents utilize groundwater for drinking water, and we are successful with that. I mean, we have very few, if any, maybe a few smaller public water systems that have nitrate contamination. Even sampling private wells, if they're high in nitrates, it's typically associated with, for example, one of the ones I worked on, property right next to some of the fields in Worley, from fertilizer and so forth. But largely, that's has not been a concern in our area, and even we get a lot of scrutiny from some of the groups, even like on the North Fork of Dakota Lane, for example. But the water quality testing that's done by DEQ, on all of the surface water, essentially, supports that if we're able to apply, state of Idaho rules effectively, that there, even with the increased development, if it's done appropriately, there's not a corresponding degradation of water quality. So that's something that's been, been highlighted in the WAG meetings. It's really, it's positive, but just nice to see that after working through so many years of development in the county.
So we will. Short answer is we're going to continue to advocate for the counties and solutions, and be at the forefront of those discussions.
Okay.
So, but we do appreciate your time today.
Yeah,
and
thank you very much.
Thank
It was
you.
we will see
informational.
you in a couple of months.
Yes.
Okay, thank you.
Thank you.
Meeting adjourned. Thank you.
And then